This is the question that we are all looking answer to. We have been talking to Chinese counterparts since the beginning of the pandemic. It was always clear that at some point we will need to look into origin of the virus for various reasons, not only to try to prevent future exposure and contact between wherever this virus came, and most of people believe from animal world, and the human population, but also to understand better that human-animal interface for the future. Already in February 2020, in our first research and development forum, this was one of the areas that has been identified by more than 400 scientists who participated as something that we will need to be looking at in the future. We have sent the first group of scientists in July and August to try to prepare this longer term international team work on a study that hopefully will gain some knowledge and try to fill this gap in where the virus, how virus jump to the human population. But let's just be clear, and many people don't know this. These things take time. I will just remind you, for example, of SARS, of Ebola, and other diseases that we have been looking into origin of the virus. It is something when you look back in time, you just realize that you may not find all the clues so easily. For example, for MERS, Middle Eastern Respiratory Virus, it took more than a year to just link the virus, that is also part of the coronaviruses, to camels. So it's not unusual that these studies need some time. We hope that the mission that has arrived in Wuhan last Thursday will be able to, by working with the Chinese scientists, try to see what they have already been done and what needs to be looked upon in order to fill the gaps in our knowledge.
Yeah, and because it's such an arduous process, I imagine part of what's critical now is to be asking the right questions. What are some of the questions that the WHO officials will need to get to the bottom of to try find out where things started?
Well, it is basically looking into several areas. One is the early epidemiological data, trying really to, as much as possible, to see people who have been early diagnosed with SARS-CoV-2 virus, what were data about that epidemiological tree, trying to sort of do detective work around where the virus was spreading in early days. Now, obviously, that is not that easy because let's remember the virus has been identified in Wuhan, but we cannot be 100% sure at this stage that the first human infection happened in Wuhan. So this is something that we have to look at, and that's why we are going to Wuhan, because this is the place where the virus has been identified in. Then we need also to look into animal and environmental samples that have been taken at that time in around the seafood market, but also in other places in and around Wuhan, to see if there was anything that would indicate where what was contaminated and how this interaction between the virus and the first cases happened. We also need to try to see with genetic sequencing and molecular tests on origins and differences in early days of virus. We have to understand that at the beginning of every epidemic or pandemic, the priority is definitely to save lives. And you will remember that Wuhan had gone through a drastic lockdown in late January and February, and obviously that was the priority at that time. But some studies have been initiated, and we are now working with Chinese scientists to see what has been done, what more needs to be done, and how we can collectively try to to gain some knowledge.
Right.
And again, just to reply to your first thought that it's a politicized, well, WHO is a scientific organization. We don't do politics, so we will just follow the science. Unfortunately, there are politics around that are done by other people, but for us, we simply look into science, and we will go wherever scientific evidence will lead us to.
Right, and that segues quite well into what I was hoping to get to. How worried are you that China or Beijing may prevent access to critical information for politically motivated reasons, even though you're there just on a scientific mission?
Well, again, we are scientists, so our job is to ask questions, to try to find answers, and we will keep doing that. We call on all member states of WHO to be quick in sharing their information. We understand that countries had different priorities during the early days of outbreak, and that's the case of every country. For example, when we talk about epidemiological data sharing, there was no country in the world that was providing precise epidemiological data, and there's a good reason for that, because doctors and nurses were busy saving lives, and no data is ever complete. So to pointing fingers and to blame is not the right way forward. The right way forward is to try to work all together. It's in our collective interest as a humanity to get to these answers and prepare better for what may come in the future. So I think we should all step back and try really to think in a way that we are in the middle of a war, and we need to do everything we can to find solutions in a spirit of solidarity by following science and only science, and try maybe to leave politics for some other days.
What we're also seeing are reports suggesting that the official version from China itself is that the virus has officially been defeated. But I'm sure you'll agree that there isn't much data to go with that. Do you find that to be strange?
Well, I will just repeat what I said. We will follow the science. Right now, there is no hypothesis that is proven. So it's perfectly okay to develop hypotheses and look into all possible ways. But for that, we need some proofs, and to have proofs, we need access, and we need space and time, also time to work. And we hope that the international team who is on the ground now working from quarantine at this moment will be able to have that space and time when they get out of quarantine and start visiting places in and around the Wuhan, and will not be pressured into any politics.
Right. I'm interested to find out how even that is complicating what already is quite a complex mission, right? The idea that the scientists themselves need to guard against the very virus they're investigating. Are you able to share with us some of the challenges that they're facing whilst they're in China, insofar as that is concerned?
When it comes to quarantine, it's perfectly normal that we follow the national protocols in any country where we are. When you travel somewhere, you do follow protocols of that country. In China, it's 2 weeks quarantine for international travelers, and it's perfectly normal that this will be observed. Now, from the day one, the international team has resumed online meetings with the Chinese scientists, because these meetings had not started when the team arrived in Wuhan, but started months before. And I was able to listen to some of these meetings. They basically went straight into deep science on data and what has been available and what needs to be done.
All right, you did mention that this will take some time. The question on everybody's mind, I imagine, is how much time are we talking? Do you have even an estimate of at which stage we'll finally know where COVID-19 came from?
No, we cannot speculate.
Yeah.
We wish we could give you time, but unfortunately, we don't know. And we hope that sooner rather than later we will have some answers. But these studies on the samples, epidemiological studies, looking back in time, take time. Hopefully we will get answers, because as you have said in your introduction, it is extremely important that we try to get some answers, but not often we are really able to get precise reconstitution of events, to know who was the first patient who got infected. But again, even if we find what could be intermediate species in animal world, we know that coronaviruses are harbored naturally in bats, quite often because of the limited interaction between bat and human population. There is the animal species, so we have to look into that direction. But again, we will remain open. The team will follow any clues that have come their way.
All right, thank you very much for sharing with us what you can. We certainly appreciate your time and your insights. Tarik Jasarevic is the WHO spokesperson. Live to us there.